Each year, between 20,000 and 30,000 Belgians suffer a concussion, a mild traumatic head injury, usually after a fall or a traffic accident.
A mild traumatic brain injury, when we are dealing with trauma to the head, after fall, for example, and those patients may display some kind of loss of consciousness for less than 15 minutes, having some retrograde amnesia for almost 1 hour, and some of those patients may display some kind of vomiting and headache as well.
More than 90% of patients undergo a CT scan in order to examine whether there's any possibility of brain damage. It's striking that only 5% of them actually have brain damage. An alternative for the CT scan is a blood test that measures the amount of S100 beta in the blood. S100 beta is produced by cells in the brain.
Your head is hit by a fall or by a concussion. Then this protein gets released into your bloodstream, and then you can actually measure it there. And so this is a very good indicator for your doctor if he measures S100 beta in your blood.
We have now at our disposition the S100 protein, which can be measured in the bloodstream. And if the results are negative, we might be quite sure that there is no brain damage what will be shown on the CT scan.
So in fact, in Scandinavia, the S100 test has already been integrated into the medical guidelines for diagnosing a suspected brain injury. So you first do a blood test for S100, and that helps you to avoid unnecessary CT scans, because a CT scan uses radiation, and radiation can be potentially harmful for your health. So if you can avoid it by ruling out a brain injury first with a blood test, it's a good way, and it's also a very beneficial way for your healthcare system.
Nearly 30% of unnecessary brain CT scans could be avoided through the combination of examining external signs in the patient and the determination of the protein S100 beta in blood serum. The new method also saves healthcare costs.
Well, the S100 is an interesting test because in patients with a mild brain injury, if we apply the test first, then there is a big potential for savings. About 300 to 400 euros can be saved for the health insurance per patient, and on the country level about 7 to 8 millions of euros.
For the patient, he will be able to be cleared for the emergency department as soon as possible and not be able to be observed for at least 12 to 24 hours at the hospital. For the hospital as well, that means that we will have more beds available for those who need it more.